First off, I'll talk a little bit about sort of what's going on at the state level, all right, in terms of there is a state advisory council. For those who do not know, there's an advisory council on autism spectrum disorders in the state of Kentucky. It is currently codified by an executive order of the governor. The bill that actually made it law, unfortunately, didn't pass in the current session, but it'll be reintroduced in the next session. There's also an Office of Autism. For those of you who did not get the announcement, it was announced on Tuesday. There's a new executive director whose name is Amy Cooper Puckett. And Amy is our grand facilitator in the state of Kentucky. And it's her job to connect people together, to collaborate together, to diagnose and take care of children and adults with autism. You all know that there was a needs assessment that was done. I think I heard at least one person speak about it who spoke in front of the group. What did the needs assessment say? Well, the needs assessment said exactly what the same needs assessment said in 2005. Okay, so the needs haven't changed. We need more services, more diagnosis, more providers. Okay, and that really goes to the core of one of the things that I'm going to talk about today, very briefly. Not as much as I would like, because I actually present all of this to the council on Thursday. But you all are getting a little bit of, you guys are getting a little bit of a preview on it. Secondly, I will talk about the U of L Autism Center and what we do at the center, what our plans and what our vision is for the center, really as sort of the nerve, sort of the core of what goes on in the state of Kentucky, because we are the only comprehensive autism center in the state, and we have the only currently the only diagnostic evaluation center within the state of Kentucky. So, with that as a background, I will say a little bit about my career, but nothing prepared you for autism at all. So I trained here in Kentucky, where I got my MD and my PhD at the University of Kentucky. I did my undergraduate at Vanderbilt, and I've done faculty stints at Vanderbilt, Kentucky, Duke, Harvard, and Washington University School of Medicine. I actually didn't come to the autism world actually until 2008. Sorry, 10 years difference. In 2008, I was actually asked to become involved through a friend of mine at Vanderbilt with the Autism Treatment Network, which is really what our state is going to be patterned after. The Autism Treatment Network is a network of 17 academic hospitals that all collaborate together and trying to coordinate the care of children with autism spectrum disorders, as well as and treatment of them, but also to do research on those and to try to answer specific pivotal questions, of which there are a tremendous number of questions in autism that need to be answered. So, anyways, our ideas for the state of Kentucky are actually to pattern a network/regional set of centers, much like we have with the Autism Treatment Network, around the state of Kentucky. My grand dream is actually to put a regional autism center within 90 minutes of every kid in the state of Kentucky. That's the goal. But can't do it all at once. Unfortunately, we have two regions in Western Kentucky that have tremendous resources and tremendous enthusiasm for people to try to pilot these sorts of centers. And one area is in Bowling Green, and there's a lot of enthusiasm around Western Kentucky University and resources at Western Kentucky University that can be used. And then, of course, I'm here to find out and seeing a lot of enthusiasm within the room for people that we can collaborate. The idea behind this network, which is called CATER, it's the Kentucky Autism Initiative in Treatment, Training, and Research, is to have the regional autism centers actually centered in the Commission for Children for Special Healthcare Needs. And why the commission? The commission is really it's an infrastructure, so to speak, that we really don't have to create de novo. Okay, it's already there. It's funded by our taxpayer dollars. For those of you who don't have children who are in the commission and managed by the commission clinic, they do phenomenal work. They absolutely do. We as providers, we come in, we help take care of these kids. They communicate with us back and forth, and it truly is in a setting of collaboration that wonderful nurses like Belinda and the other folks at the commission clinic collaborate with us in taking care of neurology patients. And child neurology has actually collaborated with the commission for well over 30 years, as I think. At least I've been to clinics for at least 20 of those years, I know. So it's a model that works very well. And it's a natural model for autism around the state, because autism really is multidisciplinary. And there's really one organization in the state of Kentucky that really can do that, and it's the commission. And the commission's used to doing that. So we're looking very forward to it. We are actually having our initial talks tomorrow morning with providers in the area, and we're going to see the commission clinic itself. The idea behind the initial collaboration is for us to make the clinic autism friendly, okay, as well as obviously to start developing the team, the staff that's going to take care of, the nurses that are going to take care of, the therapists who are going to take care of, the psychologists, and of course for us to figure out collaboratively, Dr. Cecil, who are going to be our who are going to be our MDs who are involved in this clinic, and what's the relationship of the commission autism clinic to the local pediatricians and the local MDs who are there. And as I also said, this is something that the commission is very excited about, and they actually want this to be something that is, something that goes across the lifespan. Even though technically they stop at 21, the commission really wants to take this on as a project. They feel that it really is one of their it goes to their central core mission, and the mission of the commission, is to provide medical care where healthcare gaps exist in the state of Kentucky. And I think we all in the room can agree that there's no greater healthcare gap in Kentucky than autism. I experienced this firsthand in 2001 and 2004 when I had my child here, and I can very easily confess that I don't like the way my providers knew or did not know things. I didn't like what my schools didn't know, and I just didn't like the whole situation of how my kid was going. My kid wasn't progressing at all. So of course, our solution to that was to find some place that knew how to do that. And that's why we ended up in Tennessee for a decade. And my son did very well down there. Autism kids in Kentucky and adults in Kentucky deserve the same first-class care that they get in Massachusetts or New Jersey or Nashville or anywhere in the United States. There are many, many, many providers and we're all here, and a lot of us, not all of us, but a lot of us have a great deal of experience. We understand what evidence base is in terms of treatment for autism, and we understand what's a good diagnosis and what isn't a good diagnosis, which is a very, very important part of that as well. Okay, and I think everybody can understand that capacity is a real issue. And part of what CATER is designed to do certainly diagnosis and treatment is part of it, but the T part of it is incredibly important, okay? You can see I've got gray hair in 15 years. Dr. Cecil back there probably won't be around forever as well. We have a real gap in terms of there are actually a lot of very senior providers, at least in the medical community anyways, who are within 15 to 20 years of retirement. We need a system to be able to train new providers, new MDs, new psychologists, new occupational therapists, speech therapists, etc. We need a framework in which we can do that. And the collaborations that we're trying to set up between the universities are really starting to, we're starting to form that scaffold in which we can build a tremendous number of training programs. And that's actually characterized by what's called a LEN grant. And that type of grant really can be up to $1 million a year, which can fund a lot of trainees throughout the state. So, all right, so that's one. Let's get to the U of L Autism Center.